This conference will now be recorded.
ఇది లేదు మన దగ్గర స్టెరిలైజర్ లేదు దగ్గర. Okay, good morning everybody. Is my voice audible?
Yes, sir.
Okay. So today, we know that forensic medicine per se syllabus was completed. So both forensic medicine and toxicology. And today I'm dealing with practical aspect. We know that in your practicals there are 4 exercises. You have drunkenness certificate, you have injury certificate, you have PM certificate, and then you have age estimation certificate. There are 4 certificates a student has to learn, and then mostly about 2 or 3 here in our institute we are dealing with only 3 certificates. So drunkenness is compulsory, injury is compulsory, and then age estimation is also compulsory. PM is a little bit question and answer type will be there. So whatever it may be, all these 4 certificates are very important both for your learning and also for your practical aspect. So in future, so it doesn't matter. So it doesn't matter. So which specialty you will take in future. You got to issue these certificates. So suppose you have done general medicine after, may I say, for about 6 years or 10 years from now, and then you are practicing in your clinic, and any police nearby has brought a person who is in intoxicated condition, and the police has asked you, sir, please issue a certificate, please examine this person and issue the certificate whether this person is drunk or not, or in which state he is. So you got to issue a certificate which is a medical legal certificate. So it can be submitted to the court of law, and then it has all the legal authority over that person. So that's why all these certificates are medical legal certificates, and you have to be careful in issuing these certificates. So today we will look into drunkenness certificates. So drunkenness we'll see by definition. So drunkenness is a state of intoxication of alcohol under the influence of which the person loses control over his faculties. What are meant by faculties means mental abilities like thinking, like reacting, emotions. All these will come under faculties. So to the extent of being incapable of executing safely the occupation in which he was engaged at that particular time. So it is not material time, it is spelling mistake. It is at that particular time. So it is a state of intoxication of alcohol under the influence of which the person loses control over his faculties to the extent of being incapable of executing safely the occupation in which he was engaged at that particular time. So drunkenness by itself is not an offense unless it is accompanied by some acts of commission or omission which causes danger to life or property of some other person. So we know that drinking by itself is not an offense. You can drink at your home, you can drink in the bar, so it's not an offense. Then when will it be offense? If you drink and drive, then it will be an offense. If you drink and then create a nuisance in the public place, then it is an offense. If you drink and destroy public properties or any other person's property, like breaking a window panel of the car of the other person, then it is an offense. So drunkenness by itself is not an offense, but if it is accompanied by either acts of commission or omission, which causes danger to life or property or some other person. So alcoholism is a disorder characterized by bad habit of excessive drinking. Not only affects the personal health but also injurious on social, moral and psychological grounds. Now alcoholism is a major thing both in familial problems also. In family issues, alcoholism has a role mostly in middle and below middle classes. So a person, a male who is alcoholic has always a problem in his family. Either a financial crisis will occur because he is taking the normal essential amount or money which is used for eating or feeding the children, and the person will be drinking, taking this amount and drinking. That's why the family will be in a poor state. And then social grounds, the person will not be respected. A person who is alcoholic and then he is roaming on the streets, so people will not respect him because alcoholism, the behavior, because it is voluntarily decreasing one's ability to think. It is voluntarily decreasing the mental faculties. So because of that, people will not respect the person who is having an alcoholic habit. And then moral aspect also. The morally, a person now committing a crime, mostly it was said by the research that people who are committing the crime, they will drink alcohol prior to that. Prior to committing a crime, they will have a drink of alcohol in order to decrease their fear or in order to increase their action. So you can see in many examples in India where before any rape case, the people are drinking. The people will be in a state of alcoholism. Before any crime, the people will be in a state of alcoholism. So all these things, and also psychological grounds. Psychological grounds, maybe some other financial, maybe failure in life, failure of love affair, whatever it is. So alcoholism as a characteristic which it affects both physical, moral, social and psychological health of the person. So what is the relation between the drunkenness and the medical practice? So we know that if a doctor, this we have seen in infamous conduct, infamous conduct, we have 6 A's. If you can remember in the first chapters, infamous conduct has 6 A's, where A stands for number 1 is alcohol. A person or a doctor who takes alcohol and then operates on a patient, he is in a state of, he will be booked under rash and negligent act, because a doctor should not drink while looking at the patient. He can drink while it is above or he is in a leisure time where he is not seeing the patient. that is okay for him. But if he is seeing the patient, then before that he is drinking, means that is an offense, and the doctor can be booked under section 304A, which is rash and negligent act, and the punishment will be 2 years of imprisonment. So an act performed by a doctor under drunken state leading to death of the patient, doctor can be prosecuted for rash and negligent act 304A IPC, 2 years imprisonment. Suppose if the doctor has performed the surgery in a drunk state and then the person has not died, even in that condition also, the police can book, or the relatives or the patient can book the doctor under rash and negligent act, because even the patient was alive and not dead, but still it is a risky area. It is a risky. The patient life was put under risk because of your drinking. So in that case also, a doctor can be booked for rash and negligent act, but the punishment will be of low. Maybe it can be a fine, or it can be of 1 month or 2 months of imprisonment. But if the patient dies, then the punishment will be of 2 years of imprisonment, and then he can be removed from the, his name can also be removed from the medical register. We know that it is called professional death sentence. Professional death sentence can be given in a case of rash and negligent act. So management of the patient in a drunk state regarded as an infamous conduct, name can be erased from the medical register. So which we know that it is a professional death sentence. His name can be removed from the medical register, and then he is not allowed to practice for the rest of his life if the crime is very grievous or serious, and if the crime is of less serious nature, the doctor can be removed from the register, maybe a particular duration, maybe 2 years or 5 years, like that. What are the rules of drunkenness, driving, and the law? So driving a vehicle on public thoroughfare under the influence of alcohol is an offence which is punishable under section 185 of Motor Vehicle Act. We call it as MVA Act, Motor Vehicle Act, under section 185, where if the person is driving under the influence of alcohol, then he can be booked under section 185 of Motor Vehicle Act, and the fine is about 2000 rupees, or imprisonment up to 6 months, or it can be both. So 2000 rupees fine, 6 months imprisonment, or it can be both. So these are the levels of alcohol that are advisable, above which he can be booked. So the statutory blood alcohol concentration in different countries, so in India it is only 30 milligrams percentage. Suppose if your blood alcohol level while driving your car is about 32 milligrams per 100 ml, then you will be booked under rash and 185 of MVA Act, drink driving. In Sweden, it is about 50 milligrams percentage. In USA, it is about 100 to 150 milligrams. In England, it is about 80 milligrams percentage. So these are the values above which the person will be booked under drunk driving cases. So what really does this alcohol will cause to the you or cause to the body is, one, it will decrease the reaction time while driving. So normally a person while driving, whenever a sudden obstacle comes in front of him, he will immediately apply brakes. So this is a normal reaction in a normal person. Suppose if the person takes alcohol and then drives, this suppose, and then a sudden obstacle comes in front of him, his thinking will be delayed, and then he will not apply the brakes immediately. He will have a time lag. He will have a slow process. His reaction will be dull, and then his thinking will be dull, and then he will not apply brakes as quickly as needed, thereby leading to accidents. So this is called reaction time. The reaction time, the reaction to an obstacle in which to stop the vehicle is the reaction time, and this reaction time is decreased. So thereby his thinking time will be increased. So, and then false and unjustified increase in confidence. Now alcohol will increase a false and unjustified increase in confidence. There is no real confidence, but he will, because the confidence increases because of the removal of inhibition. So the inhibitory action which is present in the normal individuals will be removed by the presence of alcohol in the blood. Thereby it is leading a false confidence. There is no true confidence. The true confidence will come from inside, from the moral well-being. But this alcohol is making a confidence level which is false, which is again after uh, this alcohol blood concentration or decrease, again he will be in a depressed state. Again, in order to decrease this depressed state, he will again have a drink again. So it is like a cycle. So the person will, in order to get the mood elevated, he will drink alcohol, and then after the alcohol concentration in the blood decreases or becomes zero, then he is still in a depressed state, and in order to recover from this depressed state, he will again have the drink. So this kind of cycling is the reason for alcohol dependence and alcoholism. And then it dulls judgment and affects vision. So it will have a poor vision. So particularly the night vision will be a problem, and the judgment will not be fair. The person cannot judge fairly while driving, and then the confidence level will increase, and the reaction time will be decreased. So these are the Road Transport Authority 2019 changes that have been made, and these are the fines and uh, sections under which a person can be fined. You can see first one, if the person is driving without an helmet, the fine of 1,000 will be charged on him. Driving without helmet, fine will be 1,000 rupees, and drink and drive, fine will be 10,000 rupees. These are the latest fine values at present. So drink and drive, if a person is caught, and then the fine will be about 10,000, and then if the person is driving,
This conference will now be recorded.
500, now it is 5,000 rupees. Drink driving, previously it is about 2,000 rupees, now it is 10,000 rupees. Speeding or racing, previously the fine is about 500 rupees, now it is 5000 rupees. Vehicle without permit, this is not necessary, this is only for the lorries where for interstate transport. So driving without qualification means a person should be at least 18 years. So you can see old amount is 500 rupees, now it is 10,000 rupees. Not wearing seat belt, so previously the fine is about 100 rupees, now it is 1000 rupees. So you can see here the government of India has enormously increased the fine amount of traffic regulations. So drunkenness and criminal responsibility. So under section 85 of IPC, a drunken person absolved from criminal responsibility provided the drink was given to him without his knowledge and against his will. So here we have two sections, section 85 and then section 86. In this, one is involuntary intoxication, another is voluntary intoxication. 85 IPC, section 85 IPC is involuntary intoxication, where suppose a person has asked for a cool drink, say thumbs up. So his friend, without the knowledge of this person, has added to his cool drink some alcohol drink, and then he has given to that friend that this is just a thumbs up, and then he has taken it, and because of his alcohol intake, he has committed some crime on the way to his home. So he can plead in the court of law that he is unaware that he has taken alcohol, and he was forcefully given against his will and without his knowledge. So in that case, he can absolve from the criminal responsibility. This is called involuntary intoxication, section 85 APC. The next, section 86 is voluntary intoxication. In this, a person wants to commit a crime, he has intention to commit a crime, and in order to commit a crime, he takes an alcohol, and then he goes and commits a crime. Then that is a punishable. So alcoholism is of two types in criminal responsibility. One is section 85 IPC, section 86 IPC. Another is, so in section 85 it is involuntary intoxication, where the person gives alcohol without his knowledge, and section 86 is voluntary intoxication, where the person knows that he wants to commit a criminal act, and then he voluntarily takes the drink, and then he leads into that. So what is the objectives of this drunkenness certificate for a student? First is to decide whether the subject is under the influence of alcohol or not, whether the condition is due to illness or injury, and to detain in the police station or to admit in the hospital the concerned person. So there are three objectives mainly to write a drunkenness certificate. One is whether the person is under the influence of alcohol or not. Number two, whether the condition is due to illness or injury. Sometimes the head injury can cause drowsiness. He can be swaying. He can be incoherent. So we have to know whether it is because of alcohol or because of injury. And number three is whether he can be put in a stay in a police station or he should be treated in the hospital. So these are the things which a medical officer should be in his mind while writing the drunkenness certificate. So what are the differential diagnosis of alcohol intoxication? So these are some of the conditions which can mimic alcohol intoxication, like drug intakes, especially barbiturate group, carbon monoxide poisoning, hypoglycemia. Hypoglycemia symptoms can also be there, where the person will be drowsy, unable to speak, and then post-concussion state is also a condition which occurs in RTAs. And then we have psychotic state, where disseminated sclerosis is a disease condition where a psychotic state can have a pre-coma like conditions. And then coma-like conditions can occur in diabetic coma, drug-induced, or even in cardiovascular accidents or CVAs or strokes. So these are some of the differential diagnosis of drunkenness: barbiturate poisoning, carbon monoxide poisoning, hypoglycemia, post-concussion state, psychotic state, which is in disseminated sclerosis, and if the person is in coma, you have to differentiate from diabetic coma, whether it is drug induced or whether it is cardiovascular accident related or stroke related. And this we have seen while we are doing CNS depressants. So we have known about 7 stages of alcohol intoxication. 7 stages. One is stage of sobriety, stage of euphoria, stage of excitement, stage of disorderly behavior, stage of stupor, stage of coma, and stage of death. So stage of sobriety, we know that if the blood alcohol concentration is about 0 to 50 milligrams percentage, then the person will be in stage of sobriety. And we have a small mnemonic which we call it as dry and decent. The person will be dry, means the person will not be in a sweating stage, and his alcohol level in the blood is also a little bit, not much. And then he will be decent. He will not sway. His talking will be okay. He will have the normal reaction to the conversation. There is no slurring of speech. Nothing will be there. He is decent and dry. If the blood alcohol concentration is from 50 to 100, then he will be in euphoria. Euphoria, where his moods will be elevated. He will be delighted and devilish. If the blood alcohol concentration is about 100 to 150, then he is in a stage of excitement, where he will be dizzy and he will be delirious. If the blood alcohol concentration about 150 to 200, then his behavior will change. He will have a disorderly behavior. We call it as delinquent and disgusting. If it is 200 to 300, the person will be in stupor and he is dazed and dejected. If it is 300 to 500, he will be in coma. He is a dead drunk. And then if it's greater than 500, he will be dead. And we call it as dead as dodo. Dodo means it is a bird, dead as dodo. So these are some of the picturized way of saying. You can see in 0 to 5 milligrams, the person is standing, he is dry and decent. And here in 50 to 100, he is delighted and devilish. In about 100 to 150, he is dizzy and delirious. He needs a support. And in about 150 to 200, he is delinquent and disgusting. He will not be able to stand properly. In about 200 to 300, he is dazed and dejected. So he is lying, sitting, and if it is 300 to 500, he will be lying on flat. So dead drunk. So these are the stages. And when a person is brought to you in casualty or in your clinic, you have to assess in which stage of alcohol intoxication the person is there. You need not measure blood alcohol concentration. We don't have the instrument. Only instrument we have is that what is that? The oximeter, which we put in your mouth. So we call it as what we call it. 1 second. Yes, breath analyzer. So we have breath analyzer for testing on a roadside, which has a mechanism to detect the blood alcohol concentration. So in clinics, we will not use the breath analyzer. We can take the blood sample and we can send it to the forensic laboratory to analyze the blood alcohol concentration. But clinically, we have to assess at what stage of alcohol intoxication the person is there, so that we can give treatment to him, whether he can be put in a jail or whether he should be treated in the hospital. So these are some of the mnemonics that are used for confirmation of ethyl alcohol poisoning. So you can confirmed is the mnemonic name. C stands for confusion or confabulations or memory loss of the recent events. So the person will have loss of recent events. The person cannot identify what is the 1 hour back what he has done. Oh, means what is the breakfast he has taken, or what is the lunch or dinner he has taken. He will not be able to recall the recent events. Oh, order of the breath. So we know that alcoholic, we have the stale of alcohol, the breath will be alcoholic, and and then N stands for nystagmus. The eyes will have a rapid eye movement, either horizontal or vertical. F stands for funny expressions. There can be slurred speech or fuddled thinking. Fuddled means thinking means dull thinking. So there is no active thinking. I stands for incoordination and postural instability. The person may not able to stand, or even if he stand, he will be swaying to the sides. R stands for rapid, full or bounding pulse. Rapid and full bounding pulse because of increased volume of blood, because of the alcohol. So there will be rapid and bounding pulse. M stands for Mardin, half drunk, tearfully affectionate or familiar. You know, Mardin means a sentimental person. Mardin is a sentimental person where the person will be having sentiments. He will be tearfully affectionate. So E stands for eye in the bloodshot. So eyes will be angry looking. Eyes should be means there is increased flushing. Congestion of the eye will be there where the eyes can be in reddish measure, and then pupils are dilated and sluggish to reaction. And D stands for demeanor, deviation of the behavior, bearing, and deportation. So these are some of the just mnemonics to remember easily what to look into the patient. Confirmed. So this is the drunkenness certificate. We have the reference number from the police station. Police station case number. The case number will be there in the registry of FRA in the police station. On the date will be mentioned under which section the person has been booked. The police will give you, and then you have to write the name, age, sex, and address of the person, and you have to write who brought the patient, whether the police has brought the patient or some other unknown person has brought the person. You have to write, and write the name of that unknown person, or write the name of the police, whoever has brought that person, and you have to write the marks of identification of the patient. You have to write 2 marks of identification, and then you have to write written informed consent. You have to take written informed consent even the person is in a uh, alcoholic. If the person is brought by the police, then you need not take it. If the person is brought by police and booked under section, then you need not take it. Even then, you have to ask him if he is conscious. If he is conscious, you have to take consent. If he is unconscious, definitely you have to ask the relative person, or you can ask the police person. And mention the date and time of examination, and you have to write brief history. Has he consumed alcohol, or how much he has consumed? If the person is able to talk, if the person is not able to talk, then you have to ask the same questions to his relative. Time of consumption, nature and quantity of the consumption, which brand he has used, and suffering from whether he is suffering from any diseases. And you have to write what is the general appearance, whether his clothes are tidy or whether his clothes are muddy. So you have to mention whether his hair has combed or not. So all this general appearance of the person, built, you have to write. And disposition, whether the person is talking calm or abusive. and whether the speech is normal, slurred, thick, or incoherent. The clothing, whether it is untidy, disarranged, soiled with vomitus, and smell of alcohol, dry lips, furrowed tongue. So all these things you have to mention in your drunkenness certificate. Eyes, whether the conjunctiva is there, pupils, whether dilated or not, presence of lateral gaze nystagmus is present or not, and then stance, whether the person is able to stand without swaying, gait, whether steady or staggering gait, whether the walking with feet wide apart, we have to know. You have to test muscle coordination test, finger nose test. So finger nose test, we will allow the patient to point the finger from outside, and then immediately you ask him to show the finger. So finger nose test we have to do. Normally the person will not able to do. And then buttoning and unbuttoning of the shirt, a person cannot go because of the fine movements are lost in alcoholics. And then picking up objects from the floor, he will not have the coordination. So reflexes, see for reflexes whether they are normal or depressed, and then look for writings. So we will ask the patient to write some sentences, whether he is writing normally or whether there is any deviation. And then we will see the vitals, pulse, BP, respiratory rate, temperature, and then we will examine the CNS. So examination of mental status, whether the ability to recall recent events is okay or not, and whether orientation of time space person is there or not. We will ask the person, what is this place you are there? So whether he's telling the answer correctly or not. We will ask any son or daughter or father or mother to identify him, whether he is identifying the person or not. And then we will see for laboratory examination. So we will collect blood sample, about 10 cc are collected, and then we have two preservatives. One is sodium fluoride and then potassium oxalate. Sodium fluoride prevents enzyme activity of the blood, and potassium oxalate is also a preservative which is used to detect alcohol in the blood. So normally when alcohol is sent as a Vedra sample to the forensic science laboratory, they will not do immediately. They will take 24 hours or 48 hours or 72 hours. So depending upon the viscera load and the previous workload. So in order to prevent the escape of alcohol or degradation of alcohol, we use the preservatives, sodium fluoride and potassium oxalate. We can also collect urine sample, about 100 ml is collected, and the preservative use is phenyl mercuric nitrate, which is used to prevent bacterial growth in urine. So in blood, we use sodium fluoride and potassium oxalate. In urine, we use mercuric nitrate, phenyl mercuric nitrate. So this is the breath analyzer. We have seen normally the traffic police people will be having this breath analyzer. So it contains dichromate and H2SO4. Dichromate is crystalline dichromate is which will detect the alcohol in the breath, and then it will come as a reading. So these are the three reports we can give in a drunkenness certificate. So we have to write exactly the same, taking into the consideration of the history and the clinical findings. I am of the opinion that the person has consumed alcohol and is under the influence of alcohol, has consumed alcohol and not under the influence of alcohol, and number 3 is not consumed alcohol and not under the influence of alcohol. So there are 3 possibilities you can give. So the person is consumed alcohol and is under the influence of alcohol. Number two is the person has consumed alcohol but is not under the influence of alcohol because he has taken very low quantities. And number three is he does not consume alcohol at all. And then you will put your signature, your stamp, and then you will give the certificate. You will put your register number, and then you will give it to the police officer. So this is Widmark's formula. Widmark's formula is to estimate approximately the minimum amount of alcohol in the body consumed at the time of collection of blood or urine. So this is a crude method of calculating what is the blood alcohol concentration. It is Widmark's formula called. It is to estimate the amount of alcohol in the body at the time of collection of blood. So the formula is A is equal to PRC. A is equal to PRC. A stands for weight of the alcohol in grams in body consumed. So weight of the alcohol in grams. P is body weight in kgs. C is concentration of alcohol in the blood in milligrams per kg. And R is constant, which is 0.6 for men and 0.5 for women. So A is equal to PRC. P stands for body weight in kgs. C stands for concentration of alcohol in the blood. R is a constant, which is 0.6 for men and 0.5 for women. A is weight of the alcohol in grams in the body consumed. So A is if for urine in alcohol. So for urine alcohol, the formula is 3/4 PRQ, and Q is alcohol concentration in grams in milligrams per kg body weight. So this we have already seen signs and symptoms of acute alcohol poisoning. We have stage of 7 stages. So remember them. And then if there is chronic alcohol poisoning, we have a side effect called delirium tremors, which can be due to temporary excess of alcohol. It can be due to sudden withdrawal of alcohol. It can be due to shock after receiving injury, and it can be also due to acute infections. So delirium tremors is also one of the effects of chronic alcoholic poisoning. So these are some of the other things which a person can have. You can have insomnia, restlessness, disorientation. All these are signs and symptoms of alcohol intoxication, which I am not dealing. Already we have dealt in CNS depressants. There can be auditory and visual hallucinations. There can be alcoholic polyneuritis and cause-of psychosis, acute alcoholic hallucinosis, Wernicke's encephalopathy, alcoholic epilepsy, and March-Fowler syndrome, which is a degeneration of corpus callosum. So chronic alcoholic patients can have degeneration of corpus callosum, which we call it as March-Fowler syndrome. March-Fowler syndrome. Mallory-Weiss syndrome, where there is a rupture of esophagus with hematemesis. There is vomiting of blood. So because of the rupture of esophagus, so Mallory-Weiss syndrome. And then there is one entity called Alcohol Anonymous, AA. Alcohol Anonymous is a worldwide organization where the people who wants to get rid of the alcohol can register in this Alcohol Anonymous, where a person who has already overcome the alcohol addiction can teach the other person who is having the problem of alcoholism. So this is a peer group for helping one another. So alcoholic, we call it as Alcohol Anonymous. The name anonymous means unknown. So the person who is helping the other person is not known. Normally the alcoholic patients will have this fear of that they will be known, their disease will be known, or their problem will be known to others. So this is called Alcohol Anonymous, where the person will be unknown to him, and then these unknown persons will come together and they will help each other in order to get rid of this alcohol intoxication, that we call it as AA, Alcohol Anonymous. So this is a picture. My doctor said only 1 glass of alcohol a day. I can live with that. So you can see the size of the glass. So thank you very much for your patient listening. So we'll continue in the next class.